All right, everybody, it is officially time for us to get started. Today, we are going to break down the Next Gen NCLEX. My name is Rachel Taylor. I am the Director of Nursing here at Archer Review. So all things nursing school, all things NCLEX are my bread and butter. And I am super excited to hang out with you all over the next 30 minutes. So if you are like, hey, I really think this would be helpful. I know some other nursing students who would benefit from this or nursing graduates. Feel free to tag them in this, share this live so that others can benefit from it as well. Now, somebody's asking, hey, yesterday I tried to join that PEDS webinar. What happened? We had a system malfunction with the time change. It put it in one section in an hour different than where it was on all the other platforms. So we just decided as a team what time session we needed to go with. And if you need that recording, go to our YouTube channel. You can find it on our YouTube for the PEDS lecture from yesterday. So that is available for you. So totally okay if you missed it yesterday. Today, though, let's get focused on our topic of the day, which is breaking down Next Gen NCLEX. I want to work on NGN items with you because when we work on it together, we're going to be a lot more confident on this. And I've got some tips and tricks. Now, if you're joining, let me know in the comments, how do you feel when it comes to Next Gen? Do we like NGN items? Do we feel like they're a bit challenging? Where are we at today? Where do we feel like you would rate yourself when it comes to your NGN knowledge base? Okay, somebody said like a 5, but it's kind of challenging. Some people hate them. Some people like them. Okay, I'm seeing that in Zoom, Facebook, YouTube. I'm not seeing any responses yet from you all. TikTok, let me know. How do you guys feel when it comes to NGN items? Do we like them? Do we feel like they can be challenging? I know usually it's bow ties. People are like, help me on bow tie items because they can be a little bit tricky. But the more you work on these, the more confident you're going to get on them. And that's our goal today. So the best way to learn them is to really practice them. And so what we're going to do is we're going to look at several standalone items here together. And looking at our first standalone, when you get a standalone NGN item, this is what I want you to do. I want you to make sure you look at the question first. Now, why would I give you this tip? Well, the question is going to guide you of what you really want to look for throughout that information. So let's take a look at this together. It wants us to know what the client is at highest risk for and what's it related to. So when I'm going through that mass amount of content they give me, I'm thinking, is this mixed edema coma? Is this catatonia? Or is this adrenal crises? So now that I know what I'm looking for, it's a lot easier to really key in on this key information here. So let's go through this together. I'm going to get my little pen out as we go through, and I'm going to highlight what we think is important. So I'm going to go sentence by sentence. And when something seems off, when something makes your red flag go up, I want you to drop it in the comments because that's going to tell me, okay, we need to underline it. So we've got a 53-year-old male presented to ED with his wife because the client had become quite tired over the past several days. Today, he was difficult to arouse and spoke incoherently. What concerns do you guys have from these first two sentences? Okay, he's quite tired, so it seems like it's more than normal. But my big thing is he's difficult to arouse. Good, you guys got it. And he spoke incoherently. These are red flags as nurses. When you can't arouse someone when they're, incoherent in their speech, we're not understanding them. That's not their normal. We have a change in normal. Now, here's our next section. The client responds to his name during the assessment, but does not respond to any other questions. His pulses are weak, thready. Sorry, pulses are thready and slow. I added the weak. Obvious tenting was noted in the skin, which was warm and quite dry. No facial drooping was observed. And when asked to hold out his arm, he could not perform the task. He did not have purposeful movement during the exam. Now, what red flags are you all seeing? Let me know in the comments. Yeah, those are some issues, right? Absolutely. So right now we're going through the first step of clinical judgment, which is we are going to what? Anyone remember? Recognize the cues. We need to recognize what things are a concern here. Very good job. So the no purposeful movement, good. Facial droop. He couldn't hold out his arms. Pulses are weak and thready. He's tenting. So the client has a medical history of gout, bipolar, and hypothyroidism, hint, hint, for which he takes levothyroxine, allopurinol, and quintiapine. She reports that he has been taking his medication as prescribed. However, she noted he was recently placed on prednisone for a gout flare. He self-discontinued the drug after taking it for 2 weeks, and he feels better, and he did not taper as directed. What red flag do we have here? I think we might have a winner when it comes to this medical history. The medical history, guys, gives us so much information. Never skip it. It tells you what is expected, what is unexpected. Yeah, he went cold turkey. He did not taper off of his steroids. What happens when we don't taper our steroids? What occurs? Anyone know? Let's see if you guys can answer this. And he's got a 12 lead. He's got peaked T waves, sinus tachycardia. We've got these vitals. But what do we think's going on? Do we think it's the myxedema coma, the catatonia, or the adrenal crisis? What do you guys think? Lots is going on here. It can be hard to identify, but remember that key information of he did not taper his steroids. What it means by tapering. This is a great question. I'm so glad you asked it. When I taper steroids, it means maybe they're getting a full pill to start, they're getting their full dose, and then we slowly reduce that to a half, and then we maybe would reduce it to a quarter, and then we would go where they're not getting it at all. So we're decreasing the dosage over a period of time so that the body is able to really respond to that change. And now I need to make the steroid again instead of it being given to me. I agree. I'm thinking this individual's in an adrenal crisis. How do I know adrenal crisis? Well, I want you to think of Addisonian disease, okay, or Addison's. When someone is in Addison's, why are they in that? Because they don't have enough steroids. So what happens when we do not taper a med and slowly reduce that dosage is the body says, oh, shoot, where'd all my steroids go? Because we were giving them to our client and now their body has to produce them on their own. And so that's what makes us concerned about this adrenal crisis, okay? The body can't just flip like that. It likes slow change, not quick change. Now, when we look at the assessment here, what was the reason? What caused it? The cessation of prednisone, the lack of purposeful movement, or the history of hypothyroidism? What do you guys think? Yeah, we just talked about this. It was exactly that cessation of prednisone. Now let's talk about scoring on an item like this. This is an if then or a because that, right? When we have items like this, it's called rationale scoring. And what rationale scoring is you have to get both points correct. If you chose the wrong condition or you chose the wrong assessment, you would get a 0. You have to get them both right to get the point here. So when you're going through rationale questions like this, do exactly how I showed you of, all right, let's look through and really see what information we're looking for, then go through our content, because there's going to be a ding, ding, ding. We have a winner when we go through all that material. But if we go through all that material first for a standalone and we don't know what we're looking for, then we maybe will miss that because we don't know what we're looking for there. Now, with that, only do that tip on standalones. Unfolding items, you're going to do it in the normal order. You're not going to go to the item first and then read through. That you want to do in the normal order. All right, who's ready for our next question? Oh, I have something I didn't point out on this question. Remember when we looked at the EKG and we saw that there were peaked T waves? Why would we see peaked T waves when somebody is in Addisonian crisis? Does anybody know? This is really connecting the dots. This is like clinical judgment to the max. So I'm curious if anyone knows why we would see those peaked T waves. So you're right that it indicates hyperkalemia. Why do we get hyperkalemic when someone's in Addisonian's disease or an Addisonian crisis or adrenal crisis? Why would we see it there? Because remember, what do steroids do? Like aldosterone. Aldosterone is a steroid. It causes sodium and water retention and potassium excretion. If we remove that aldosterone, that steroid from the body, we now are not going to retain the sodium and water and excrete the potassium. Instead, we're going to excrete too much sodium and water, and we're going to hold on to all that potassium. Does that make sense? It's really important to start making those connections. That's when you're really going to start getting NCLEX ready. Everyone see that connection we just made? All right. Amazing. Amazing. All right. Who's ready for our next question? We want to do another one? Are you guys like, yes, this is helpful? All right. Awesome. Perfect. Let's do another question. So the nurse, they're caring for a client 4 hours post-op after laparoscopic gastric bypass surgery. So we're going to look what it's looking for first, because I want that detail before I just go to fill it out. So what it's looking for is select the anticipated provider order from each of the following categories. Each category must have at least one option selected, and each category may have more than one option selected. All right, let's look at our information together. We've got a 31-year-old female, post-op laparoscopic Raux and Y procedure. The client is fully alert and oriented. Glasgow Coma Scale is 15. The client reports pain at the incision as a 4 out of a 10. 4 surgical incisions were assessed as clean, dry, and approximated with skin glue. Bowel sounds were hypoactive in all 4 quadrants, and the indwelling catheter was secured to the bed frame without kinks or loops. Clear yellow urine was observed. Cap blood glucose was 268. Okay, what red flags do we have? Anything that we're like, I don't know about this? Anything that you're like, we maybe want to think about it? Yeah, the glucose is high, but the body's been under quite a bit of stress. She does have uncontrolled diabetes mellitus. What about these hypoactive bowel sounds? Am I concerned about that? Or are we like, hey, that's kind of normal here? What do we think about the hypoactive bowel sounds? It's normal post-op. It's expected. So it's not like a huge red flag to me. And I do always like to note the type of procedure, right? Because that can change what's expected and what's unexpected. So let's just do this first category. We're going to give a 1, 2, 3. Activity. Do we think we want them on strict bed rest, out of bed restrictions, or out of the bed to the chair? Let's just do these one at a time. That's how I like to look at these. To me, if I look at the whole question, it's overwhelming. But if I just look at these by little sections, it becomes a lot easier for me. Yeah, absolutely. We want them out of the bed to the chair. So we just have one correct one there. All right, how about our diet? Clear liquids, full liquids, nothing by mouth. What do you think? She's had surgery. What do we do after surgery? I love, someone said, I passed my NCLEX as a foreign nurse with sure pass NCLEX of Archer. Love Archer. Thanks for that feedback on TikTok. Congrats. Welcome to the nursing profession. I agree with those of you that are saying 1, the clear liquids. Why? Because they're post-op. If they were pre-op, I agree on the NPO. They're post-op. They've got hypoactive bowel sounds. Let's give them some clear liquids and let's see how they do. Let's see how they do. And absolutely, you guys are like, what about the gag reflex? Yes, I'm not just going to give them fluids and be like, oh, have fun, right? I am going to assess that. But when we look at this, everything's okay. There's no reason they couldn't try some liquids, right? So I'm okay with it. Yes, I'll make sure it's safe before I do so. But I think the clear liquids would be just fine. And someone said, what about the hypoactive bowel sounds? Totally normal after surgery to have hypoactive bowel sounds. There's no concern with that. All right, our medications, multivitamin, hydrocodone, acetaminophen, or Docusate. And you may have more than one, hint, hint. What ones do we think here under the medication? So let's think about it. Would someone who's just had gastric bypass benefit from a multivitamin? Is there a risk that they could have a vitamin and mineral deficiency? Absolutely, yes. So because of this, we want to make sure they're on a multivitamin. So I'm saying yes to one. Now, they have a 4 pain, right? Do we expect them to have some post-op pain? Yes. So when they have that using an opioid mixed with acetaminophen, this is a great pain control method. So we're saying yes to 2. Now, DocuSate. Why would I use DocuSate? What is that? What would the benefit be? It's a stool softener. It's going to prevent constipation. They just had a significant surgery. So if they just had a significant surgery, don't we think it would be beneficial to make sure they're on a stool softener, because constipation is pretty likely to happen in this scenario? Absolutely. And what I will say is, I feel like almost everyone ends up on those stool softeners. Man, my highlighting looks a little crazy, but you guys get the point. All 3 of those are correct. Now let's look at our next column. Do we want to do a consult to a dietitian, a diabetic educator, or for ostomy care? Or is it several of these? What do you all think? Yeah, I agree. 1 and 2. Why do I think that? Well, if they are to the point they needed gastric bypass, then they probably do need help from a dietitian. And let me tell you, I know people who have had this surgery done, and it's hard. It is hard. I know from the outside looking in, it's like, oh, it should be easy. It is not. It is not easy for them, and they struggle and they need support. So how I've always seen it done is they actually will start with the registered dietitian before the surgery. They will do that for several months before, start making those changes, have the surgery, and then even continued with that dietitian for up to a year after. Now, we do need that diabetic educator on board. Why? Because they're an uncontrolled diabetic. And let me tell you, there are so many complications from being an uncontrolled diabetic. We want to help them, or they are at risk for all kinds of things. And then lastly, for example, they could lose a toe, they could lose a foot, they could lose a lower extremity. I don't want that to happen, so let's educate on it. And then lastly, the venous thromboembolism prophylaxis. Are we going to do nothing? Are we going to do sequential compression stockings, or SCS? Or do we want prophylactic anticoagulant therapy? What do we think here? What are we thinking? 1, 2, or 3, kind of the same order we've been following here. I agree. If we choose either of the bottom ones, we can't choose none. And we for sure want those SC, the compression stockings. And then the other thing we really want is a prophylactic anticoagulant. Typically, how I've seen it done for the people I know that have had this is they will take heparin injections. They'll do heparin injections to really make sure, low molecular weight heparin, but they'll take these injections, right? And why do we do this? Well, because we don't want them to clot, and they're at a higher risk for clotting, right? When we think of people who are more sedentary, if they're obese, there's a higher clot risk there, and we want to make sure to prevent that. So how would scoring work for this item? Well, scoring for this item would be +1 for each correct option chosen, -1 for each incorrect option chosen. So for this one specifically, there's 1, 2, 3, 4, 5, 6, 7, 8, 9. This is worth a total of 9, okay? 9 points. Now somebody said, why would we give this post-op heparin? They're going to do it as a sub-Q injection, not as a drip, and that's something that they can go home on. They do the low molecular weight heparin a lot of times. And the reason why they're doing that heparin is they want to prevent them from getting a blood clot. They're at higher risk for a blood clot. They want to make sure that they prevent that. So they'll do an injection. How I've seen it done, the client will go through an extensive kind of training on how to do the injections, side effects to watch for, when to call, and they monitor them fairly closely. Very good job on that question. While I have you guys here, I do want to talk to you about Archer Review tutoring. This is really designed to fit your needs, whatever your learning needs might be. So private tutoring we offer, it is $75 per hour, or another thing that we just started offering is we offer 30-minute sessions for $40. So if you're like, Rachel, I just need you to look and tell me, hey, am I NCLEX ready or am I not? Book the 30-minute session. Like if that's truly what you're looking for, book the 30 minutes. If you're like, Rachel, I need a full hour, I need some help outlining a custom study plan, I need XYZ, then look at the whole hour. Do what's best for you if it's something you're interested in. We also do have small group tutoring, which is where you come with a group of students and you learn about something like prioritization. You learn about Jennifer has one that's how to answer NCLEX style questions, going through those and breaking them down. There's all kinds of different things out there that are available to you. While I am talking about this, though, I do want to share with you something I have today from 12 to 2 Central. It starts in just an hour and a half. This is the last chance kind of to sign up for it, is we're hosting a 2-hour NCLEX review webinar. This webinar is going to be from 12 to 2 Central today. We're going to go through everything high yield. So if you are within 2 to 3 weeks of taking your NCLEX, I would highly encourage this 2-hour NCLEX review. I'm super excited about it. I originally created the 2-hour NCLEX review when I first started working for Archer 3 years ago, and it's evolved so much since then. But we're going to have a ton of fun today. So if you are interested in that, that is a paid event. It has dedicated chat support. They'll get your questions answered. It's going to be a really good time. How you get to it, just go to Archer Review Webinars and then scroll to this 2-hour NCLEX review, and that's what you will get to. So if you need that help, this is where you can find it. All right, I know you all are sick of me talking about all of our products, so let's go back to our next question. It is recorded. The 2-hour NCLEX review is recorded. I'm still working with my tech team on how long the recording will be available, but you will get access to the recording starting, we should have it by Monday, and you will get it for either 2 weeks or 1 month. We're still working on the details of what that will look like on the tech side. I'm not a tech expert. I'm a nurse, so tech things are not my expertise. All right, here's our next question. It's basically just an extended select all that apply. How do you all feel about select all that applies? This is going to be the last question we have time for. Do we like select all that applies? Do we not like select all that applies? Congrats. I've got 2 more people who just said they passed the NCLEX with Archer. Amazing. Thanks for letting us know. Thanks for hopping on just to let us know that. We love it. Welcome to the nursing profession. All right. It looks like a lot of you are like, I hate SATA. I want to change that mindset today. And here's why. If I go into work, right? Let's say I'm starting my job. I'm teaching you all and I say, I hate doing this. Am I going to be effective at teaching you guys? What do you think? If I showed up today and I said, I really hate educating. I don't. I really love it. I hope you all know that. But am I going to be effective if that's my attitude? No, I'm not going to be very good at it. So I want you to change the mindset around select all that apply items. Instead of saying, man, I really hate these, I want you to say, this is giving me the opportunity to showcase my knowledge. The other thing that I want to be very clear on with you all is you don't have to be perfect. You do not have to get them all correct all of the time. You want to work for progress, not perfection. So try to do your best every single time you answer questions, but it's okay if you miss some of the time. That is always acceptable and fine. And so let's take a look at this item together. And I'm going to give you a few tips and tricks to help you get them right. So first of all, what's it asking about? What orders does the nurse anticipate? Okay, so I'm thinking about orders. We know that this client has dyspnea. So let's read through our case. And as those red flags happen, I want you to drop them in the chat. So we have an 86-year-old male brought to the emergency department by his wife. After sleeping for 8 hours, the client woke up reporting chest heaviness and a non-productive cough. What concerns do you have right now? What concerns do you have right now? Chest heaviness, non-productive cough, any worry here? Yeah, when someone says chest heaviness, chest pain, I'm thinking something's wrong, right? So let's see what else is going on. I do want to note this non-productive cough. Sometimes that can help us to determine Do they have a pneumonia going on? What else is all going on here? So they've got shortness of breath, fatigue. The client took a dose of his prescribed albuterol and reported no efficacy. If it did not work, if the albuterol inhaler didn't work, do we think this is an asthma attack or do we think this is something else? What do we think? Do we think it's an asthma attack or do we think it might be something else? It might be something else. We want to make sure we're open to that it could be something else yet. The client repeatedly state that something does not feel right. I'm going to point something out right now. When I have had a client tell me this, when I have had a client say, I think I'm going to die, you know what's happened? Within the next 10 minutes, they've coded or they have had something majorly wrong. So if you have a patient tell you something does not feel right, I want you to start investigating what's going on. Hopefully you catch it. But I know I've had times I didn't catch it before that and they have said that and something has gone wrong in the next 5 to 10 minutes. People know their norm. And if something's way off, they usually let you know. So if someone says, Rachel, I think I'm going to die because I've heard this before, get moving, get ready because something's going to happen. Try to investigate what might be going on. Now, the respiratory exam yielded that the client's respiratory rate is 24 breaths per minute. 2 days ago, they returned from a 16-hour road trip to visit their son at college. Is this a distractor or is this pertinent information? Does this 16-hour road trip matter? Because a lot of times in these, they're going to give you all this information and you have to decide what's important here and what isn't. This matters. What is a client at risk for when they are in the car for 16 hours? Somebody said a pulmonary embolism. I like the way we're thinking. The client has a medical history of asthma and diabetes. So what do we think we're going to do? Do you think this client needs, so now let's do the 3 steps of ASATA. Almost skipped it, but let's do it. This is what you do. You've gone through the information. You've got your red flags. Now you have to ask yourself, okay, the 3 steps of SATA. The first step is, what is this question truly asking? So what orders does the nurse anticipate from the primary healthcare provider? What's that truly asking? What orders do I expect? Short, sweet, and to the point. Step number 2, am I looking for true or false statements? True means I'm looking for what's correct. False would be I'm looking for what's incorrect. Don't ever skip step 2. Anyone ever answer a question and accidentally answer it as if they were looking for the true answer, but it was really supposed to be the false? Raise your hand on Zoom or put a comment in. I have done that. I can't tell you how many times I did that as a student because when I'm stressed, I skip things. I take shortcuts when I'm really stressed out. Don't take the shortcut. Double check. Am I looking for true or am I looking for false? And we're looking for true here. Now, the third and final step is to go through these one at a time and ask yourself, is this true or is this false? So A, chest physiotherapy. Is this going to benefit my client? A lot of you said, we think he might have a PE. Is chest physiotherapy going to help us here? No, it's not going to do anything for us. Not going to help us at all. How about pulmonary function tests? Are those going to give us any insight? By the way, when we would do chest physiotherapy is when our clients have like bronchitis and we're trying to get those respiratory secretions out so they can cough them up. Pulmonary function test. Why would I do a pulmonary function test? Typically, we're checking a pulmonary function test to see, hey, how's their asthma doing? How are these things, going? We don't need that right now. That's not going to benefit us. What about a PPD skin test, a purified protein derivative skin test? Is that going to benefit us here? Or are we like, maybe not? What do we think? Yeah, it's not going to benefit us. When would I do that test, the PPD? When would that be beneficial? When someone's been exposed to TB, it's the tuberculosis skin test, okay? There's nothing that indicates they've been exposed to TB. They were on a road trip. If they've gone out of the country, then I would be more suspicious, okay, depending where they traveled. D-dimer. Do we want to check a D-dimer? What's a D-dimer? Tell me. Tells me if there's a clot somewhere in the body. We think our client likely has a pulmonary embolism. So do I want to check a D-dimer? Absolutely, I do. So we are saying yes to option D. E-albuterol. Is the albuterol going to help with a pulmonary embolism? Is that going to do me any good in this scenario? No. And then lastly, F, chest computed tomography or a CT scan. Would a CT scan help identify a pulmonary embolism? Yes, absolutely. Do you guys see how I went through that? Does that maybe differ from how you have maybe gone through Select All That Applies before? I want you to try to do it this way. Try it for this week and see how your scores do. Anyone here change their answer a lot? Anyone here feel like, ooh, yeah, she's talking to me right now? If you feel that way, if you're like, oh, yep, I do change my answer a lot, I want to encourage you this week. If I were to give you one tip, if you learned one thing from me today, try to not change your answer and see what happens. The reason I say this is when you constantly change your answer, you never know when to trust your instinct or when to trust your gut. And I want you to work on trusting that instinct and trusting your gut to the best of your ability. But thank you guys so much for hanging out with me today. I know we didn't go through a ton of questions, but I wanted to go through them intentionally and with purpose. So give us a follow if you're joining on TikTok, if you're joining on Facebook, make sure you're following us so that way you can see when we go live. We go live several times a week. And I just want to leave you with Archer Review is here for you across the journey, across the lifespan of the nurse, from the day you're trying to get into nursing school all the way through NP school. And one last reminder, if you are interested in our webinars, go to Archer Review webinars. You can register for them on Zoom. You can also attend this 2-hour NCLEX review. It's $25. It's from 12 to 2 p.m. Central Time today. It's going to be an amazing event. There are several hundred students already signed up. So this is kind of your last chance to sign up if you are interested, but go ahead, give that a register if you are interested. I'm going to do it once a month. I'm going to see how this one goes, but I think I'll do another one in April, like mid to end April. Is when I'll do the next one. Yep, from 12 to 2 p.m. Central Time today. So it starts in an hour and a half for that 2-hour NCLEX review. And again, to find it, you can just go to Archer Review webinars and it will be the second one that pops up. So if you go to the Archer Review webinars, this is what it's going to bring you to when you search that. Make sure it says NCLEX RN on demand, but then scroll down and it'll be listed under right here for the 2-hour NCLEX review. It's going to be fun. So if you're interested, go ahead and consider registering for that. But thank you guys so much for being here. I hope you all enjoyed it. Did you guys like this style of webinar? Do we like it, or are you like, Rachel, ditch it? We need a different kind. Let me know. Awesome. It looks like you guys are like, yes, they liked going through it a little bit slower. So we will plan to do more like this. I think it was a great time. Thank you for taking your time out of your day to hang out with us and for being a part of the Archer Review community. We are rooting for each and every one of you, and I hope you guys have an incredible, incredible day. Bye, everybody.